नमस्ते। मैं डॉक्टर भूषण काळे और आज हम हैं बाली में। हम बाली में एक इंटरनेशनल कॉन्फ्रेंस के लिए आए हैं, नीमा गायनिकॉन 2025, जिसमें आज हमारे साथ है डॉक्टर कोमांग सुदारमी, जो कि बाली से है, जो कि आयुर्वेदा में जिन्होंने अपना सर्जरी में एमएस कंप्लीट किया हुआ है एंड शी इज़ पीएचडी आल्सो। आज का इंटरव्यू हम इंग्लिश में लेंगे, जिसके सबटाइटल्स आप हिंदी में आपको हम नीचे इस वीडियो में देंगे। So welcome Dr. Komang.
Thank you, sir.
So here in Bali we begin with Om Swastiastu. So to begin with, Dr. Komang, we will like to know how you came to Ayurveda, how your journey of Ayurveda began, and how right now how you are serving the Bali people with the Ayurveda.
Yeah, so I started my journey after my senior high school. Before going to Ayurveda field, I was in the Chimaya mission. I was doing youth empowerment program, and after that I continue with Ayurveda. How am I interested? It's just like coincidence actually. After senior high school, I was proposed by my father, who's working in government Hindu religion affair. So he was the one who has the idea of getting one of our people to get into the subject of Ayurveda. And now I like it after I learned this, and I feel really blessed.
So you have done your master's in surgery, that is
Yeah.
Shalyatantra in Ayurveda.
Yeah.
So what is the importance of Shalyatantra principles that you have learned in your master's that you are applying in your practice right now? What are the things that right now you are practicing in Bali?
So in the subject, I'm blessed to have this gone into the field of Shalyatantra department because I'm having interest on the surgical things. So what I got, especially in hemorrhoidal conditions, yeah, we did a lot of case related with hemorrhoids, operations as well as Ayurvedic. And the important is it's very significant to change even our behavior because surgery, even in Ayurveda, it's very precise. Precise in the sense in our life, even we use hygiene, we use a very humble and simple technique just to keep and maintain our lifestyle, and then it's applicable in every sense. So in here, obviously we can't do operation in Indonesia because we don't have legal permission for that. We are working on that, and we've been making an organization which has 7 members, and they are all graduated from India for Ayurveda. Yeah, so yeah. So in our organization, we try to introduce Ayurveda concepts in all sense and all subjects, and now it reaches to the level that we already have a place for our members. So in 7 members, we have a place, we have a building where we work in the office, and each one of us has our private sector of work beside this. But we hope this progress in the level of government next, so that Ayurveda will be recognized in Indonesia.
You mentioned about the hemorrhoids.
Yes.
So we would like to know about hemorrhoids. What are the causes of these hemorrhoids? And you today spoke in this conference about hemorrhoids in pregnancy.
Yeah, yeah.
So we would like to have lights on hemorrhoids in pregnancy specifically.
Yeah. So hemorrhoids is one of the symptoms that happen in pregnancy, but as in specific, hemorrhoids happen in pregnancy for the reason of mechanical. Mechanical in the sense there is the creations of intra-abdominal pressures, which is created by fetus, and then low volumes of blood, gushing of blood, and as well as the constipation, which is one of the symptoms also in pregnancy. So all this combination, aspect of combination, happened to be the most background of hemorrhoidal disorder cause in pregnancy.
So as you mentioned about the causes, what the pregnant woman should take care to avoid these complications like hemorrhoids?
Yeah, as this body changes in pregnant women is unavoidable, and it has to happen to nourish the fetus. Of course, the things that we need to pay attention is diet, diets, adjusting of diet, maybe a lighter diet, more fresh diet, more the diets which can easily digestible by the women, as well as good rest. And other than that, consumption of warm water or maybe digestive herbs, like which is very safe for pregnant women, could be applied. And if in case constipation, which is a common disorder, common symptom that happen in pregnant lady, if that happen, maybe consumption of internal ghee, as well as maybe castor oil only for smaller dose, so that it can help in constipations. A lot of fibrous diets, and then more to Kegel exercise to support the muscle in lower pelvic floor.
So in short, just you mentioned castor oil in mrudu virechan, whatever we call it.
Mrudu virechan.
So mrudu virechan, just like castor oil. Do you use any specific herbs or specific home remedies in Bali for
Yeah.
the such purpose?
Because in Bali we don't have much of herbs that we learn in Ayurvedic syllabus, but here we find like shunti, adrak. We have most of the hinguashta composition. Also we have avipati composition. We have, so all these are digestive. Lemongrass, triphala is also available in our country. So it's medicine for all the thing. Constipation, for sits baths, for regulations of the bowel movement, everything could be applied.
So definitely the things which you have mentioned, even Indian pregnant women also can use
Yeah.
in their pregnancy
Yes,
as well
yeah.
to avoid complications, or if they are facing some problems related to hemorrhoids,
Yes,
then
sure.
they can use this. So again, I want to ask, along with these hemorrhoids, are there any other surgical conditions which commonly come across the pregnancy, and how to deal with them?
Yeah, for the pregnancy, usually fissure because of constipation. Let's start with that, and there might be polyps or maybe sluggish bowel movement. Surgically, hemorrhoids, and this the fissure is the common. Maybe fistula somehow if there is an infection, but commonly during pregnancy, hemorrhoids and fissure, both this only will cause the surgical case.
So what could be the complications because of this? Whatever these conditions or these are incidences, whatever the pregnant woman is facing in pregnancy.
Yeah, even though in hemorrhoids bleeding is not that intense, but that also can affect, because a mother with the fetus, already the burden and complication of disorder. I think losing blood is not required in this case. That's losing blood, one of the complication which we are concerned in surgical things, as well as intraabdominal pressure, pelvic floor weakness can cause prolapse sometimes of the rectum, and yeah, constipation is the most actually, yeah, to begin with the symptom.
So like pregnancy itself is one of the cause of constipation.
Yes.
So along with the ghee, we can use ghee milk.
Yeah.
Like along with that, we can use some mild purgatives, as you said,
Yeah.
in the pregnancy. But that too with the doctor's prescription and doctor's advice you have to take. So that is ideal. Any things like exercise or workout or any other specific measures that pregnant woman should take care of during pregnancy, what would you suggest?
Being active, actually, from the beginning of pregnancy is required. Maybe because I've experienced of the pregnancy, doing Surya Namaskar every day, breathing exercise, just to exercise, to practice the whole body system, because facing delivery is not that easy without your breathing as well as the pelvic floor support, which naturally without exercise your pelvic floor will be flexed.
Right.
So pelvic floor Kegel exercise, especially butterfly posture in yoga, as well as the constriction and relaxing of the sphincter. Maybe start with that, and some leg exercise, so that the blood vessel also will be circulated good.
So whatever these surgical conditions, the pregnant woman is facing, what are the right now incidences? Are there high incidences just for the case of hemorrhoid specifically? Are there more incidences nowadays, and what could be the is there the lifestyle is major cause for this? What do you think on this?
Yeah. So the incidence in the total population, because if we talk about pregnancy alone, I've not checked what the data is, but in total globally it's 4.4% out of all the population. But if we see in population in Bali, it's around 13.2 million people are suffering from hemorrhoid disorder, including and excluding the pregnancy term. And what are the cause? Of course, lifestyle, because nowadays we are downgrade. If we realize it or not, our lifestyle has changed a lot. We drink the things that not supposed to drink, alerting, temperature-wise it's cold, and then lifestyle, gluten maybe, lots of dairy, and then the things that is hard to digest, especially meats, because all the things that is not consisting fibers in our food, and as well as the leftover food, now it's becoming style, because if we see in modern lifestyle, we prepare food only for one day, the full day we prepare food, and then that's for the next 7 days. Then that is causing a lot of disturbance in physiologies.
Yeah, so as you said, Ayurveda says such food as a Paryushit Anna. So we prepare for one day, and Ayurveda suggests or recommends that Ushnam Asniya.
Yeah.
So we have to prepare hot, and whenever it is hot, we have to consume it. In that way, Ayurveda mentions. But what we do is we make it Paryushit. So we prepare it and we keep it in the freezer, and we use it for long term.
Yeah.
And that is actually causing the Tridosha Dushti.
Yeah.
Tridosha Dushti, that is leading to Agnima and the Ama, and such diseases we are facing, specifically the diseases related to GIT. It was very good to interact with you,
Thank
and
you.
it was very fantastic being in Bali and meeting the people like you in this conference. So definitely we will like to have your talk in future also. So because we continuously educating the people online, specifically the patients who want to take Ayurveda treatment or who want to learn Ayurveda, what is Ayurveda, to them we educate through such kind of content. So your insights are really valuable for us. Even though you are busy, you are running late, so you gave time for us. So for that, thank you very much.
Thank you
Thank
so
you
much.
from our people, our patients, and thank you from whole India.
Thank you
Thank
so
you very
much.
much.